Medical professionals of Reddit. What's the funniest thing a patient has said under anesthesia? This woman undergoing C-section under spinal anesthesia plus ketamine said, "Show my baby first to my brother-in-law. He deserves to see her first." I sometimes wonder what happened to her marriage after that. Story 2. My dad, Italian, was waking up from anesthesia and kept looking at his Asian nurse and saying he was so glad his daughter was with him and that he loved his daughter. The nurses were confused, so they went out into the waiting room to check for his daughter. I was the only one in the waiting area, and when they saw me, they started hysterically laughing. I am Korean by birth, but was adopted by my lovely Italian family. This one is so sweet. It's very funny, but it's also just really sweet. Story 3. I just had a bowel resection and was hopped up on morphine. My divorced parents hadn't sat in a room that long together in forever. My sister, uncomfortably quiet between them, tells me my junk is hanging out of my hospital gown. And I say, if my balls are hanging out, that makes this a ball gown. Really helped with the tension. Story 4. I had double jaw surgery to correct my underbite. I took sign language in college. They typically don't wire your jaw shut anymore. They just use strong rubber bands, but you can still talk. I knew I would be able to talk. Yet when I woke up from surgery, I apparently kept trying to sign. The nurses were like, we don't know sign language, honey. Based on how little I remember from college, I'm certain it wasn't even good. Story 5. Was recovering a patient after surgery who got ketamine, which has a known side effect of making you super emotional. When she woke up, she started catcalling me, telling me how attractive I was. Then she got worked up because she was thirsty, so I told her I could get her ice chips. As I'm getting her ice chips, she starts to go, "I hate to see you leave, but I love to see you go." As I disappear to get her some ice chips, she starts crying real tears. She was afraid she scared me off and how sorry she was. Story 6. I'm a consultant anesthetist, UK, and there are loads. Often declarations of love from the patient as the drugs are kicking in. My all-time favorite is a 40-something guy a few years ago. He needed a testicle removed for cancer. He had never had anesthetic before and was super nervous, to the point of barely saying anything to anyone. As the drugs started to kick in, we realized someone was quietly singing. It was the patient. Hitler has only got one ball. Obviously, there was no melody with that. Had to make it up myself. But hey, good song, dude. Very true. Story 7. Had a patient come into recovery after surgery. She farted so loud and long the entire 20-bed unit heard her. Then she said, "I was trying to clear my throat, excuse me, and I want a vanilla latte, I got a headache." As medical professionals, we had to hold in the laughter, but that didn't stop the patients from turning into hyenas. Story 8. Not a medical professional, but my mom was coming out from under anesthesia after a procedure a few years ago, and I was trying to help her. She puckered her lips, so I picked up her water cup and asked her if she wanted some. She turned her face toward me and said, "Do I look like an airplane?" The nurses and I completely lost it. I still tease her about it sometimes. Story 9. Not a doctor, but I was told by my dentist that when he was prepping me to remove my wisdom teeth, I asked him why he became a dentist. I vaguely remember him telling me a story about how when he was a preteen, he was at a local pool running around when he slipped and smashed his chin on concrete and shattered some of his teeth. Ouch. He was so amazed at how well they reconstructed his teeth that he decided to go into dentistry. Apparently, I then looked this man in the eyes and said, "Well, that's a stupid friggin' reason to become a dentist." Sorry, Dr. J. I like to think he didn't take it personally. I really hope he didn't, because that is hilarious. But how dare you, OP? It is a good reason to become a dentist, even if your drugged up self doesn't think so. Story 10. Obligatory, not a doctor, but I was the patient. I had to get my wisdom teeth removed at the hospital because they were, for a lack of a better term, messed up. When I woke up, the nurse was going through the routine to make sure I wasn't brain dead. She asks me my name by saying, "Who are you?" I respond with, "I'm a lesbian." My parents were in the room. They didn't know at the time. That was how I came out. Story 11. In the early days of my surgical training, there was a day I was assigned to a colonoscopy list. Standard practice is to pre-medicate patients in the anesthetic bay if required, particularly if they're going to be a bit anxious about the procedure. I was clerking one of the patients in the anesthetic bay, going through consent in the usual pre-op routine, when I noticed she was giving me these weird sidelong glances, and that her eyes would dart away every time I tried to make eye contact with her. She was also extremely fidgety and was stammering in a lot of her responses to my questions. I kind of shrugged it off as preoperative nervousness, and let the anesthetist do his business. Fast forward 10 minutes and I'm standing behind her, she curled up into the fetal position with her butt hanging out, and I, colonoscope in hand. As the propofol starts rushing through her veins, she turns right around, grips my forearm and stares at me with a dreamy look on her face and goes, "You know what, Doc? I bet you kill it with the ladies." A minute later, she was asleep and I was checking her colon for polyps. Story 12. The very first time I was in 3rd grade and was relatively scared. What kept me brave was the promise of Burger King breakfast afterwards. It was an early morning procedure that required fasting and I rarely got fast food. They ended up running behind that day, so it was up in the air if I would wake up and get out in time to get my breakfast, which ended at 10. The first words out of my mouth were, What time is it? When my mom informed me it was already 9:30, I tried to get out of bed and nearly ripped out my IV in the process. When she tried to tell me that we would be late and I could get it another day, I promptly burst into tears. Hey, I thought this was funny things. This is a tragic story, man. OP deserved that Burger King breakfast. Story 13. I gave a kid methoxyflurane after he broke his arm. When we got to the hospital, he went into the pediatric section of the ED, and there were stickers on the wall of Sesame Street characters. He started talking about this unicorn on the wall, there wasn't one, and how it was trying to be friends with Elmo, but Elmo didn't want to be friends with him. His mom and I had a chuckle, and I had to pry the whistle out of his hands. Story 14. I apparently can't handle my anesthesia. The first time I woke up, I asked the nurse if I was going to be able to fight by Monday. My wife properly translated that to, can he teach his wrestling class? Before we went home, she wanted to drop off my prescriptions at CVS. She left me locked in the running car. After she dropped off the prescription, she turned around to find me in the CVS, standing in the frozen dairy section holding German chocolate ice cream. I told her I needed it because my people made it. Car was still running with the passenger door left open. Okay, for the record, OP, you can handle your anesthesia because you know what happens when you can't? You die. Anesthesia is a very delicate art. The effects on you are just a little stronger. In terms of the loopiness, I mean. Story 15. After being put under to have a wisdom tooth extracted, I told everyone for an hour that my balls were tingling. I mean, hey, they were. And folks just needed to know because it was hilarious. At least, to me, it was so funny. We had to stop by the grocery store on the way home, and I think a few dozen people there heard about it. My poor wife. Story 16. Not me, but my boyfriend. He went under anesthesia because he had 4 screwed up teeth. He is an anxious patient when it comes to dentists, so I was allowed to be with him in the room till he was finally under. His last words before the anesthesia were, "I don't want to die." And luckily, he didn't. It warmed my heart, though, because he had actually tried to end himself 2 times before I've known him, and I'm glad he changed his mind on that. After the anesthesia, he was just groggy, but on the way home in the car, he saw everything double and always screamed at me because he thought I would crash into another car. Story 17. Wasn't said directly to us, but his wife relayed the message. Her husband thought that he was abducted by aliens and was anal probed. He came in altered and couldn't follow instructions. Altered due to wicked high ammonia. To bring down his ammonia, we had to give him lactulose PR. So we gowned up with face masks, face shields, and white paper gowns, 2 each, in fact, just in case. Both of us administering are 6'3", so he recounted to his wife the next day about how he was in a bed on his side with 2 tall white aliens with plastic faces he couldn't really see, probing him. Admittedly, this isn't under anesthesia, but it is a story of when a PT was altered and we died laughing, as did the wife, when we were told. Enjoy! Edit. The reason his ammonia levels were so high is because he had liver issues and it was well known and documented. He was on meds to try to control it, but his liver was failing if I recall correctly, so he had a spike of ammonia levels which caused the AMS. He was unable to follow directions to take oral meds because he was altered, and also the best absorption for the lactulose med to get the ammonia down as quick as possible is in the backside. Story 18. I'm a doctor and was getting a knee reconstruction, and asked one of my best friend's dads to do my anesthetic. He was head of department at the hospital I worked at the time. Apparently, after he gave me the midazolam to chill time out and basically I forget everything from then on, he inserted a local anesthetic block into my leg. The next day he told me what happened. Apparently, I then told him it's not working and he should have done it higher up, and tried to grab the needle from him to show him. After I asked if he knew what he was doing, I also complained the bed was cold. We still have a good laugh about it. I can't think of something scarier. Someone who's all doped up on meds to get ready to, be operated on, handling a needle. Whew. Luckily, you probably weren't very strong at that point. Story 19. We sedated this older white lady to reduce a shoulder dislocation. I don't remember what it was, but the doctor said a couple of words in Spanish with the most gringo pronunciation imaginable. This woman was almost completely out, but her eyes shot open, and she sharply corrected the doctor's pronunciation before passing the hell out. We were all trying so hard to keep it together while we were working on her shoulder. I did have one patient that wasn't under anesthesia, but was a bit confused. This poor lady had some absolutely ranted fecal squirts all over her bed. It was everywhere. I went in, doing my best to not succumb to the acrid burning in my nose and make her feel okay about it, but she sees the poop in her bed and her eyes go huge. Then she says, "I knew that man pooped in my bed." I asked her what she meant, and she said, "There was a man here earlier and he pooped in my bed. I know it was him because I never would have done this." So I gently told her, "No, I'm the only man that's been in your room." So of course the conclusions she came to were not exactly what I expected. She then gets upset and asks, "Well then why did you poop in my bed?" I was trying really hard to calm her paranoia that there was someone coming in to take a crap in her bed under her blankets, but apparently I sent the wrong message. I was trying so hard not to laugh my butt off. I actually had to step out for a minute because I couldn't keep it together. Story 20. I've been aggressively hugged and thanked by patients post-op. I've been propositioned and informed by a particularly elderly lady that I had a perky bum and that it's okay for her to look because she's old. Many younger men just after the fentanyl and just before the propofol ask what magical drugs we've given them. The answer is always hospital-only ones. Just after extubation, trying to evoke a response from a still sleepy patient, they either roll over like you're an annoyance, stopping them from napping, or, my favorite, slap at my hand and tell me to sod off. It's a fun job. Story 21. Grandma. A few years ago, she broke her wrist and had to have surgery to get a metal plate in. In the operating room, she was on the table, and her arm with the broken wrist in question was strapped to an arm extension, so she looked like she was put on the cross with one arm. She had been given anesthesia, she was still conscious, and a nurse was standing next to her. "How are you feeling, Jan?" the nurse asked. With a monotone voice, my grandma looked the nurse in the eye and said, "I am Jesus Christ." Me. I had to get a few cavities filled last year after school. After checking in and getting in the chair, they administered the lidocaine, dental anesthesia, and nitrous oxide, laughing gas. I should mention that this happened a couple of months after December. During the operation, I took a deep breath through my nose and the gas mixed with the anesthesia really hit me. I felt like I was floating in space. Well, what do you do when you're floating in space? Sing Christmas carols, of course. The dentist and the assistant, having filled 2 cavities at this point, were double-checking the x-rays before starting the 3rd filling. I started trying to sing Jingle Bells while they got started on the filling. My face was too numb to actually make any sounds audible. For the rest of the other fillings, I tried to impress the world with my singing. Story 22. Young guys often wake up from anesthesia a bit, punchy. Had a guy who fractured his mandible on holiday in Southeast Asia. Didn't get it seen to until a few weeks later when he came home. So fixation was more complicated than it could have been, and took so long that we had to shuffle his pants down halfway through to put in a catheter. So he woke up abruptly with his pants at half-mast and his bladder feeling funny, and was furious, swinging at everyone, shouting that he was in his own frickin' house and he wanted to pull up his own frickin' pants and who the frick were you to stop him. This carried on for a full 5 minutes, with our very quiet ENT surgeon and anesthetist sweetly trying to reassure him that everything is okay. Calm down, you're just waking up, etc. Before I got sick of him, got up close and broke the spell with a big angry, "Mate, would you shut up?" It was like a switch flipped. His eyes opened and he was instantly alert, oriented, and so apologetic. Story 23. Husband had to have a colonoscopy under twilight sedation, and after the procedure, the nurses ran through the aftercare with me, since he was still too spaced out to be alone. Now, husband's energy levels can normally be described as puppy on amphetamines, so I wasn't entirely surprised when the nurse said, "We had to give him more sedative than usual, he just wouldn't stop chatting." After we left the hospital, husband demanded that we walked home, about 30 minutes, rather than getting a lift, and along the way it became clear that the drugs only enhanced his puppy-like nature. My favorite moment was when he ran away from me into a cafe, bought and paid for a crunchy ice cream. I did go and check that he hadn't done any anesthesia-related shoplifting, and then came out licking it and told me delightedly, "It makes my tongue tiz." He then proceeded to sit at a picnic bench, put his head in his hands, and fall asleep snoring loudly. I ate the ice cream. He has no memory of any of this. Is tiz like a regional sort of slang, or was he just that out of it? I assume it means like tingle or fizz, but OP definitely wrote tiz. Anyway, OP, shout out for puppy on amphetamines because that is a hilarious description. Story 24. Patient here when in labor. With my first, I was so high on gas. 18 hours of labor and about 13 hours of those sucking the gas. I was a hot mess throwing up. Maxilon didn't work and neither did my epi. Went through a portable tank before being put on the bed and having the bottles that don't run out. Anyway, I was so tired and sore, posterior too. I bit on the tube, inhaled and said, "I can't suck this any harder." My aunt responded with, "Don't say that, OP. That's what got you in this predicament." To which I proudly responded with, "No, it was my husband and his thunderdong bending me over his mum's bathroom sink." In the room, there was hubby, mum, sister, aunt, Nana, and 2 midwives. They all lost it laughing. Well, not hubby. He looked like he wanted to die. Earned him the nickname Thunderdong for many years. Story 25. Not a medic, cop, but was riding in the back of an ambulance with some paramedics. There was a guy who'd been stabbed and had his throat slit on Christmas morning a year or 2 back. Somehow his blood pressure hadn't dropped low enough to not be given anesthetic, and he remained conscious for pretty much the entire ambulance ride to the hospital. I can't remember exactly what he was saying, but it included knock-knock jokes, and generally just making jokes about how his new Timberland boots were ruined, along with the rest of his clothing, which had soaked up so much blood. Anyway, I can recall the paramedics having to hold off putting in IV lines because they couldn't find a vein from laughing too hard. It was quite surreal to say the least. Story 26. I was the patient. For some background, as a child, I used to have a recurring terrifying dream. In it, I dropped and ended a baby that I hid in the wall. In my now adult drug-riddled brain and semi-conscious state, I decided to tell the nurse and people in recovery that I had in fact ended a baby and kept it hidden in a wall for years in my parents' house. This prompted a discussion with a police officer when I was fully conscious. Thankfully, he saw the funny side. There are people who say that when you're drugged or drunk or whatever, that you speak what's on your mind, like you speak the truth. You're just less inhibited. This is proof that that is absolute garbage. I've never believed that. I think it's so dumb. But like seriously, people will say anything, and it'll be so out of context and there's no way to understand it, so don't try to read into it like it's some kind of hidden truth about the situation. Glad the cop was understanding. Story 27. I had a septoplasty a few weeks ago. Woke up in recovery insisting I didn't want the surgery anymore and to put it back how it was. Then when the nurse was pushing me in a wheelchair to the front door, I got up 20 feet before the exit and started sprinting out the building. And halfway across the parking lot to the wrong vehicle. The whole time, my dad was chasing me. So for me, it turns a 29-year-old into a toddler. I'm so lucky I didn't faceplant or get hit by a car. Story 28. I, from what I was told, started to racially abuse my doctor. His name was Doctor, the same name as a motorbike. And I started to giggle, ha, vroom, vroom, doctor, name of motorbike, vroom, skrrr. Then I said he better not try to karate chop me, and told him he looked like a cool ninja with his mask on. He increased the gas very quickly after that. Was super not cool of me though. Really don't know where it came from. Was like I reverted to being 6 or something. OP, you can't hold yourself accountable for what you said under anesthetic. I find that really funny. If anyone is actually offended by that while you are under influence of drugs, I don't know what to say. They're insane. Story 29. Not a medical professional and not related to anesthesia, but it's a funny one, I promise. After my dad had woken up from his 6-month coma due to a stroke, his memory was messed up. It was like he was on anesthesia, but for a much, much longer time. He'd recall different memories from different times and would live them/reenact, even from when he was 6 years old. One time when I was home alone with him, he suddenly got up from the living room and went into his bedroom. I heard shuffling coming from the room. When I walked in, I saw my dad stuffing bunches of stuff into bags and had taken a shirt and wrapped his face with it. He whispered to me, "Quickly grab everything you can get before the homeowner and the police arrive." I kept trying to tell him this is his house, and he was basically trying to steal his own things. He told me to go screw myself. I told him, if you don't settle down, I'll call the police immediately and they'll lock you up. He immediately froze, hands up in the air, and then sat down like a child. 5 minutes later, he forgot all that happened. A year later, he had regained almost all of his memories back, and was pretty much almost back to normal, except he was more playful than the strict father that I once had. Still, I loved him even more. Rest in peace, Dad. That one made me feel a lot of different emotions, and I think is a good one to end it on, although it isn't anesthetic. But seriously, that's like really sweet, touching, and funny. A little bit of tragedy in there too, because man, 6-month coma is brutal. Even still, pushing through a 1-year process to get most of his memories back, that's tough. I'm glad that things turned out pretty alright, OP. For both you and your father, I mean. Anyway, as I said, that'll be the one we end on. That's all the stories for today. So for now, I say thank you for watching. I hope you have a wonderful day or night wherever you are, and I will see you in the next one.